Hi everyone, Dr. Keith Mirante here, and today I want to talk a little bit about a segment with Chiropractic and Children. And you may ask yourself the question, why does a child need to be checked, their spine be checked, their nervous system be checked, and why is it so important to bring them to a chiropractor? And that's a great question, and I used to wonder the same question until I actually understood the importance of your spine, your nervous system, and the brain-to-body communication. And so when we talk about children, our first trauma that we encounter is birth. That's the first trauma we encounter, whether it is a natural delivery or whether it's a C-section delivery. C-section delivery is a lot more traumatic than a natural delivery, but it still has both of them have the risks. And so a lot of times when a child is in the birth canal ready to be delivered, there's torsion and tension placed on the cervical spine. The baby is head down in position, and there's going to be a rotation component. And typically, as that child is birthed, in a hospital setting, there's always going to be a significant amount of tension on that child's head being birthed. Typically, it's a clockwise direction that the child's head is pulled out of the canal, and that puts a lot of stress and strain upon that child's upper neck. The upper neck is the most important part of the neck because it surrounds the brainstem, it surrounds all those nerves that come from the brain feeding the body. So really important, we check children from days old. My daughter was checked and adjusted on the day she was born by myself. And we have, the youngest we have in the office is a day old, 2 days old. I just adjusted a baby 2 days old a few days ago. Now, as that child grows, the average child has over 3,000 traumas before the age of 5. And, look at your children, my child, boy, do they have their traumas. So whether it's falling off the bike, my daughter right now is learning how to ride her bike. And it's time and time and time again, she's falling off the bike. She gets up, she gets back on, and she falls. Those are traumas, and they're micro traumas. It doesn't have to be a car accident. It's repeated injury over and over, and that can shift or jar the spine around. For example, my daughter's also in gymnastics. Gymnastics puts a great deal of torsion and stress on the body because they're teaching these children from a young age to do splits, and it's typically one leg going forward at the same time. So they find a dominant leg, that leg goes forward, and so between all the pelvic bones, the bones of the low back, they're all tied in with muscles and ligaments. And so that'll start to create a torsion on that spine. And so one of the most common times that we see curvatures of the spine is something a gymnast or a dancer, because of the torsion they place upon their pelvis and their low back. So that's the most common time to see a curvature of the spine. Then there's sports injuries. And again, they don't have to be necessarily huge traumas, but they're micro traumas repeated over time that can jar or move that spine from its normal place. And so it's always better to be proactive. Your child doesn't have to complain of pain or anything like that to be checked by a chiropractor. The important thing is we check their spine. If there's nothing going on, that's fantastic. That's able to be monitored over time and make sure that child's body stays well, not just for today or tomorrow, but for 5, 10, 15, 20 years from now. We can monitor that and make sure that they stay good. Now, worst case scenario, we find something wrong going on in the child's spine. Whether it's a mild curvature, one of the most common things we see in children right now with video games and iPhones, they're always looking down at their phone right now. They're slouched over, they're stooped down, they're looking down at their phone, and that takes that proper curve that's in the neck, and it loses it. Puts a great deal of stress and strain on the neck. So that's another really important reason why we want to check those child's spine. And so a child, a teen, they have the best chance for us to correct their spine at a young age and keep it there, as opposed to letting that damage set in. Maybe that child is they're playing on the iPhone every day and they lose that curve in their neck. If that goes unchecked for 5, 10 years, 20 years, now they're in their late teens, early 20s, 30s, all of a sudden we've let something set in that could have been completely prevented today. So again, best time to get your child's spine checked is now. Don't let it get worse. Again, if there's ever any questions, I'd love to answer those questions. My name is Dr. Keith Mirante, and thank you for watching this segment on why your child should have chiropractic care.